as we think about what is important in responding to respiratory disease challenges or bacterial pneumonia. There's a couple things that I think about. The first being getting a good diagnosis, making sure that we understand what pathogens are present in our pigs, both on the bacterial and the viral side. Working with your veterinarian or your health team to get that good diagnosis so that we come up with a plan of how we're best going to manage through this health challenge and get those pigs back to baseline health as quickly as possible. The second piece of that is to understand what caused the disease, have a definitive diagnosis, and then understand, okay, was this related to a co-infection? Do I need to evaluate my biosecurity protocols to reduce the incidence of a PRRS being introduced into the population? Was this a question on environment or ventilation or different things like that? Was this around a stressful event where, for whatever reason, that pig's immune system was weakened to allow those respiratory pathogens to take hold and cause that disease? And then third and finally, that goes into that is coming up with a treatment plan. So working with your veterinarian to diagnose, remove the insult or try to resolve the insult that would have caused the disease, and then coming up with an antimicrobial plan to address the pathogens that are there. Once we have that diagnosis and we understand what bacterial pathogens are there, coming up and determining, okay, is Penchlor 64 an option for this disease process? Is Avulsin process for that? And working with your veterinarian, working with our team at Pharmgate Animal Health to understand what your treatment options are for the specific disease challenge that you may be facing. Our team is committed to finding science-based solutions to relevant challenges that today's swine producers and swine veterinarians may be dealing with. We're 100% committed to answering the questions of how do we manage SRD better for producers and veterinarians across the country.